Well, the Thanksgiving holiday is just a couple of days away, and people are already on the move to visit relatives.
A different story from last year when the pandemic kept family reunions to a minimum. UW Health's Chief Quality Officer, Dr. Jeff Pothof, is back with us with some thoughts on this year's celebration. Welcome back. Good to see you, Dr. Pothof.
Good to see you, too.
Happy Thanksgiving. But first, we have to get your thoughts on the mask mandate in Dane County being extended.
Right. I think last week we talked about whether they would extend or not, and initially with that downward trend, I think they, said likely they wouldn't have to, and then, as soon as they said that, cases started to go back up. And now it probably does make sense for just a little bit longer, especially as we wait for those younger kids to get vaccinated. They're not fully vaccinated yet, to keep those masks on for just a little bit longer, especially in those public spaces. Hopefully this is the last time.
But the criticism is you can drive 20 minutes from here and be out of Dane County, and there's no mandates.
I think that's true, and a lot of people will say, well, why does Dane County need a mandate? It has, the highest vaccination rate, the lowest case rate, like what's going on? And the real answer is that Dane County is doing so well because we have taken these steps, not because we haven't. So I think if we want to continue to see Dane County feel a little bit safer, keep people a little bit safer, these kind of interventions are helpful.
The extension of the mandate has a caveat that you can take your mask off when you're indoors if you're in a space where you know that everyone is vaccinated. But the problem is, how do you know if everyone is vaccinated, unless you're with your immediate family?
Yeah, I think that's the million-dollar question. If you're a business, I suppose you could check vaccination status at the door and then you'd know everyone's vaccinated. But even though from the science aspect that is a safer environment, everyone vaccinated, I just don't know how you actually operationalize that in different venues.
So the thought is now that the initial vaccines are like 90–95% of efficacy at first, but now 6 months down the road, they're losing some strength.
Yeah, Delta kind of foiled this for us. So before Delta, we saw high rates of immunity. It persisted, and then with Delta, we saw it drop. And then as folks' vaccines aged, got to that 6 to 8 month, we started to see more and more breakthrough infections in the fully vaccinated. Now, these folks don't typically get very ill. They're less likely to get real ill, but, they could spread the disease. Certainly, they could have some mild symptoms. And that efficacy goes from 90% to maybe high 60s, low 70%. Now, you get the booster, and pretty quickly after that, you back up to that 90%. And what we don't know is now, does that hold for a long time, or will we need to get boosters on some sort of annual basis?
Well, you mentioned that cases are going up, and actually the numbers are pretty sobering. In the last 3 weeks, the rate of disease in the community has nearly doubled, and the rate among children is at an all-time high right now. Is that just what's going on?
Well, I think our children are the most susceptible group right now. They haven't, until recently, had an opportunity to be vaccinated. So with this last surge, we saw kids involved. Now with the most recent surge, we still see those kids involved. To the point now in the U.S., COVID-19 is the 6th leading cause of death for our 5 to 11-year-olds, which is pretty crazy for a disease that I think we think for the most part is less severe in kids. That's true, but it doesn't mean kids aren't affected. So good idea to give these kids a chance to get fully vaccinated and then take away some of these precautions.
And your advice for Thanksgiving and travel?
I think, if you're fully vaccinated, your family's fully vaccinated, your risk is so much lower than folks who are unvaccinated. You can have pretty normal Thanksgiving. If you're unvaccinated, unfortunately, it's really similar to last year. You should be masked. You might want to think about postponing it virtual. If you're going to have that gathering, keep people apart, especially if they're eating with that mask off. There's just too much risk there.
And the definition for fully vaccinated is just the 2 shots or 1 J&J.
For right now, CDC is saying the 2 shots of the mRNAs, the 1 of Johnson & Johnson. I think if we go a few more months forward, you may start to see that change to the 3-dose regimen.
So if you get your booster shot, is this something we're going to have to do every 6 months?
We'll have to see. So with some viruses like hepatitis B, you get 3 and you're good. That durability kind of shores up. With others like flu, you need that booster every year. I think it remains to be seen. If you push me on it, I think it's going to be more like a yearly booster, but it's possible with this 3rd dose that immunity holds.
It's still new. I mean, we're only 20 months into this thing.
Yeah, I think we know so much more than we did before. We've got so much data on safety, efficacy, what works, that doesn't work. But it's still, in the grand scheme of diseases, pretty new. It's only been with us for like 24 months.
And now everyone is eligible for a booster if you're over 18.
Right. If you've gotten a shot and you're over 18, it's been 6 months, get that booster.
All right.
All right.
I have. Happy Thanksgiving, Doctor.
Happy Thanksgiving,
See you next week.
Doctor.
See you next
Good
week.
to see you.